Hello and welcome to the Inspired Senior Living series. The Inspired Senior Living series features new topics and guest speakers on the first Thursday of every month. The Inspired Senior Living team consists of local small business owners who serve older adults, including Entre Boyd, Sierra Dubé, myself, Nicole Noner, Kimberly Shute, and Peter Wilhelm. Today, our topic is sexuality in our mature years. Our speakers are Elizabeth Martin and Mason Munson. They both have their doctorate in occupational therapy. And without further ado, I'd like to welcome Elizabeth and Mason for our presentation.
Great, thank you so much.
Thank you so much.
Yeah, we're really excited to be here and have a lot of information to share with you all. And yeah, we'll go ahead and talk a little bit more about kind of what our backgrounds are and where we come from.
Okay. Sorry, there we go. Again, my name is Mason Munson. I'm an occupational therapist. I work in a really broad spectrum of places, from pediatrics to acute care. And one of my specialties post-graduation is sexuality and intimacy access. And so we'll get a little further into what OT looks like, just as a broad scope, and also give you some details about how we approach sex and intimacy.
And I am Dr. Elizabeth Martin. I am the owner of Holistic Community Therapy. It is a home and community-based therapy for adults with cognitive impairment and or mental health concerns. And prior to becoming an OT, I was a reproductive health educator at Planned Parenthood. So I talked all day, every day with people about STDs, STIs, having the talk and consent. And as an OT, I've primarily and more exclusively worked with adults and older adults with HIV. So that will probably come out in each of our presentation areas.
Great.
So looking at occupational therapy as a broad scope, the goal of occupational therapy is to support individuals, groups, and organizations to achieve health and well-being, and to participate in life through engagement in occupation or meaningful activities. OTs define activities of daily living as activities oriented to taking care of one's own body, and things that are completed on a routine basis. So within that, OTs consider sexual activity as one of the ADLs, and ADLs are also bathing, eating, dressing. So some of the very basic things that we do, we need to do, we want to do to care for ourselves. So today we're gonna go over various topics. And let's see, we'll talk about a few topics first, and then we'll pause for questions or any comments or anything that comes up. And then we'll kind of go through another few topics and then do a Q&A at the end. So feel free to put questions in the chat, or we will just have a pause at that time. All right. So yeah. So this, we kind of want to look at sex in a broad way, but also really there's like a lot of pieces that go into that, like looking at intimacy and communication, not just the act of sex. Yeah. And what we, desired at 30 is different from what we desire at 50. And having a conversation about, likes, dislikes, what's comfortable, what's uncomfortable, and having that communication is kind of the broader piece. Yeah, you want to add anything to that,
Of
Mason?
course. Part of why we wanted to include this little picture from Grace and Frankie, I don't know if you know that particular show, but it's about two older women who are single and kind of reclaiming their sexuality and their sex lives. And it kind of brings to light a lot of the taboo and stigma we have culturally about talking about sex as a whole, and then also the taboo and stigma we have talking about older adults and sex, as we often try to infantilize older adult or try to pretend that they're no longer sexual beings, which we all know is not true. So that double whammy really kind of silences this conversation, which is why, Dr. Martin and I are very excited to have this talk with people. And I think one thing that we like to focus on is we're going to definitely focus on what we call intimacy. Because again, when we expand our understanding of what sex is beyond just penetrative, like heterosexual sex, where our world really opens up and there's a lot of possibilities and a lot of joy to be had. And one thing we are going to talk about a little bit more is how to communicate about what you want and what you need sexually, both to your partners and also to your providers, because the more specific and the more detail oriented you can be talking to your doctors and your therapists and your providers and also partners, the better your sex life will be and also the healthier it will be. I think that's about it for now. Are you ready to go on?
Yeah.
Oh, the other thing I wanted to add is I want to clarify that when we're speaking about sex, we're both talking about sex with partners and sex with yourself, because masturbation is actually one of the really key elements to maintaining a healthy and enjoyable sexual drive into your older years. And so when you hear us say the word sex, we're both talking about solo sex and partner sex and all the variations in between.
Great. So there's a few topics around safety that we wanted to make sure to cover that would be relevant in your older years and really across the lifespan. So we'll go into depth into these a little bit more. All right, so you can go. Yeah, you can go to the next slide. All right. So one of the questions is, do I still need to use protection?
Still?
And the simple answer is yes.
Yes.
Sex may not be, for getting pregnant or having children, but there are still a number of risks and concerns related to the actual, act of sex, which is really broadly defined as skin-to-skin contact. Mm-hmm. That skin-to-skin contact can happen with, kissing, touching, mutual masturbation, and a variation of other acts that are not just genital to genital contact or oral to genital contact. So, just very, generally and briefly with STD versus STI, currently both are being used. They're sometimes used interchangeably, and they, are not always fully used accurately. So a sexually transmitted infection is what happens or can happen initially at the beginning of, getting an STI or STD. Over time, a sexually transmitted disease can happen without treatment and can be a long-term thing. So every communicable infection or disease will transmit differently. Each has a different outcome and a different treatment regimen. Some are curable, some are not. Some of the most common curable and asymptomatic STIs are chlamydia and gonorrhea. Some STDs or STIs that can be potentially fatal without treatment can be HIV, hepatitis B and C, or syphilis. So we're also going to provide a list of resources and a handout with this presentation that will kind of go more in depth into what are some symptoms to look out for and when to get tested. So, getting tested, if you're having sex, getting tested on a regular basis is really important to be able to, look for any sort of STDs or STIs that you may have without knowing it. If you don't know you have it, you can continue to pass it along. So looking at, having, if you're, trying to figure out if you want to get tested, thinking about if you're having sex without a barrier method, you're planning to have sex with a new partner, you have multiple partners, you've been worried you've been exposed. Let's see. So one of the other, one of the most basic protections with, preventing STDs and STIs is a barrier method, like a condom or a dental dam. And I will say very similarly to STDs and STIs, COVID is also a communicable disease that we are all very aware of, that has impacted us globally. And, really having a conversation with your potential partners about your health risks, what how you are doing, and in your health is really just like the key to preventing a lot of these diseases or conditions. All right, so we can go to the next. So another concern around safety is some virtual dating. That is something that is more common. I think I saw a statistic that it was like 13% of adults over 65 are now virtually dating. So there's a few risks and challenges in using technology. Some of the benefits are that you can connect with anyone anywhere, and that can be a safe way to engage in, it can be a safe way to engage in developing a relationship and or, safe sex. It's like the safest sex is where you're not having physical contact or necessarily in the same room. Also, if you're not feeling safe in a connection, a lot of the, dating sites come with their own messaging system, and you can, block someone or stop contacting them and they won't have your personal address or, know where to find you. So there's a lot of benefits as well. Some of the precautions, again, we'll provide a resource for this, but, don't share personal information like your address, birth date, or social security number, or financial information. So don't give money to individuals, versus like paying for a dating site or paying for access to a site. That's a little different than someone messaging you individually and saying, hey, can you, send me XYZ amount of money? So there's a few other precautions to kind of be aware of, but those are some pretty basic ones. Always, also if you're planning on or thinking about meeting with someone, meeting in a public place, having, a buddy to where they know where you're going to be during what times, and communicating with them before and after that. Let's go to the next slide. So consent. So there's a lot of pieces around consent. This is, the wheel of consent is one of, it's by Betty Martin. It's been around for a long time. This will be in the resource list, but it's really looking at what are you giving, what are you receiving, and what someone else is doing and what you are doing. And really looking at and learning about ways to, talk about or communicate around consent, getting permission. There's also nonverbal consent, and being able to, it's really like the communication between two people. So far, one of the concerns around consent that comes up is if you know, someone's cognition is changing, and what does that look like, and how do you really know if they're consenting? And there is a lot of complexity around that, and I don't know if there's like a blanket, you know, answer or statement around like how do you navigate that. But I think, you know, if folks, I would say, generally are in regular care and they're getting, you know, their cognition monitored and that type of thing, in terms of like, you know, early changes in cognition versus what does it look like for later changes. You know, I always promote self-determination and being able to, you know, allow folks to have choice. But yes, it is complex, and there's a lot of intricacies when someone, you know, might be in like later stages of cognitive decline. Yeah.
Yeah, and one thing I'd like to add on, I think
Yeah,
that's a
yeah.
really important subject for, aging populations. And there's definitely some high profile cases that where, a couple who had been married for 35 years and later there was a dementia diagnosis and like a person was charged with with non-consensual rape or sexual contact. And so one thing that we'll talk more about in the presentation is we're always going to, this is just a broad intro. So always talk to your providers, talk to your professionals. There is something called that professionals can do what's capacity to consent. And that's really helpful for a broad spectrum of things, including sexual contact. Can they make their own medical decisions? Can your partners decide their living wills? And so there are, I believe, attorneys and physicians and other professionals who can go through this legal process of defining if someone has the capacity to consent. So if there's ever questions about that, it might be a great thing to bring up with a provider. I love this wheel, by the way. I've never seen it. Shall we go on?
Yes.
Okay. Oh, questions.
Yeah, I had a question. Can a primary provider easily test for STDs or STIs, or do you have to go to a specialist like an OBGYN? And if so, what is the testing involve? Is it a blood test? Is it a swipe, skin test? What does that involve?
Great. Thanks for the
Great question.
question. Yeah.
Yeah.
So, so with testing, yes, your primary care provider can test for all of those things. It's a variation. It kind of depends. So, there's certain things that can be tested by blood, hepatitis, all of the hepatitises, HIV, and syphilis. And there's a and then the other ones, there's urine test for gonorrhea and chlamydia, and or a swab. So it kind of just depends on what's going on. I know that, for LGBT communities, like the swab might be used in areas that, the skin to skin contact might happen more frequently, like an oral swab or an anal swab, that kind of thing. I would also just suggest that if you're going to ask your PCP for testing, really knowing the facts around what STDs exist, so you can ask for specific tests. So a lot of times, when you go to a PCP and you say, I just want to get tested for everything, that usually the provider, that then gives the provider the discretion on what they think you should get tested for.
Yeah.
And so the everything to the provider is usually a much smaller list than the everything to what you might be thinking. So just be as specific as you can when you're asking for testing. And your provider can also give you more information on why they would consider certain ones and not others. But yeah, usually they don't test for all STDs. They usually just look at symptoms and history and partners, and that kind of thing. So, yeah.
Oh, go ahead.
Does STI mean sexually transmitted infection? What is it?
Yes.
Okay. Okay. Thank you.
Elizabeth, do you want to explain the difference between STI and STD? Because I know you taught me about that.
Yeah, so an infection is usually, along the pathway to a disease. Um, STI has been introduced a bit more to try and reduce stigma. A lot of times we think of STDs as a long-term, lifelong, fatal thing when there are actually a lot of STIs that can be treated and cured. And so it's kind of one of the differences is that a disease happens when someone starts to have symptoms,
Mhm. Yeah, I didn't know that either.
but
until
not
you told me that.
always. There's a
Yeah,
there's a
not
lot of
always.
things that are asymptomatic. So that's why regular testing, even if you don't have symptoms, is important as well.
Yeah. And I would add that this is a great um, example of something sometimes you might have to be a powerful self-advocate. Your primary care physician might not think of you in this way. And if you don't advocate for yourself that and be very explicit about like, no, I have a very active dating life, this is what I'm doing, they wouldn't naturally include STI screenings in your like annual health exams.
I have one question for you. One, is there a resource or site that gives like all the STIs, STDs, and kind of the testing for them? And then when you say regular testing, how regular are you referring to?
So yes, there is a site, and that will be included in the handout. And I usually, I'm impartial to Planned Parenthood because they provide, that is like the primary thing that they do is provide resources on sexual health and education. So they have a list of all of them. And, some of the ones that I've mentioned, there's also additional ones like trick and
Yep.
molluscum. Yeah, like there's additional ones that are, not necessarily talked about very commonly.
Yeah.
Regular testing really depends on partners. So that's what I would go by is like, if you've had a new partner recently, then you want to get tested, anywhere from 2 weeks to 6 months after that contact, whether or not you used a condom, because there's a lot of there's a few, maybe not a lot of, but there's a few STDs that are lifelong that can be transmitted even with a barrier method, using a barrier method. So yeah, it's anywhere from getting tested, every 3 to 6 months to once a year, and that's if you're having new partners. If you haven't had a new partner for 5 or 10 years, then if you were tested after 6 months after your last contact with that person, then you don't need to get tested until you have another partner or have contact.
Perfect.
Yeah.
Thank you.
And I would confirm, I also would recommend Planned Parenthood. I'm also biased because they are very specifically trained to navigate sexual minority groups, transgender patients, people who are on the LGBTQ spectrum. So they'll have a lot of really solid information about what Dr. Martin was saying about different activities require different testing. So, you're not gonna, they're prepared and ready to talk to you about it. Yeah, and one of the things that can be a great form of consent is a lot of times when people are starting new sexual relationships is they will both go get tested and then share those results as part of planning of how to have an intimate life together. And it's often kind of a natural step that people take, and it opens up the conversation about like what's safe, what are you comfortable with, what do you need. So that's something that can also be done before you begin having sex with a new partner. Depending on access and interest, of course.
As we get older, does our capability or likelihood of receiving or transmitting a disease, does that wane at all or no? Interesting.
It can actually increase a little bit, and I'll get into that in one of the next slides about, especially in terms of like natural lubrication. Especially people who are female bodied tend to lose natural lubrication either from just natural aging or as a medication side effect. And that leads to micro tears, which then makes the body more susceptible to, sexually transmitted infection. And so there's things that the bonuses, we'll get further into it, but like one of the great things about lubricant is it both makes sex feel better and it helps protect you in those ways as well.
I have got one too, real quick, guys. This may be
Sure.
a broader question, but what if a longtime partner begins to suffer from cognitive decline, and as a result of that, their sexual interests and desires change so drastically that the other partner, there may be a new compatibility issue there. Does that make sense?
Yeah.
How would someone navigate that?
That's a big question.
Yeah. So I guess I can speak maybe more from practice. The thing that comes to mind for me is cognitive decline or cognitive changes can actually, I look at or think about the impact of inhibitions. And so, not, having your inhibitions change and also your awareness of what you might be doing. Those things can create essentially a partner whose behaviors are maybe a bit more aggressive than usual without necessarily the insight to how they might be responding. And in a lot of ways, it's not intentional.
Yeah.
And so I think that, I don't know, I think like compatibility, I'm not sure if I would think of it in terms of compatibility, like that was there before. It's just there's something happening that's stemming from a neurological cause, and not because of this is who this person desires or wants to be or was. And so yeah, I kind of think a lot about what kinds of information can you get on how their cognitive changes might impact interactions, and how can we work on adjusting the environment or working on the relationship in terms of matching, or I think of compassion really, and trying to educate the other partner on how these changes are coming up and how can you maybe change and adjust how you're responding so that that person knows and understands that their advances maybe are not appropriate for the time or the place. And if that's coming up in the relationship, it's likely going to transmit to other areas of life, in terms of the person doing things at inappropriate times that just don't match the context. So I think about a lot of education and adjusting and adapting the environment to be supportive of how that person's cognition is changing.
Yeah, that's great. The only thing I would add in addition is I think this is again a good example of why it's important to communicate about sex and intimacy. And so, when you're struggling with this, you can feel really isolating when your partner, who has always been your support, is becoming a source of stress. But you still love them. And so it's important, if you're gotten more comfortable talking about these concerns and topics, and talking to your support network of friends and family and providers, and like getting professionals input on like, how can I navigate this is important for my partner and I. This is an important part of our lives and I don't want to lose this, versus just assuming that it's done and that's all it's ever going to be forever. And that can even include some really less traditional models. I think we were just talking before this training about a couple who ended up joining an ethically non-monogamous relationship where another partner came in that could help meet those physical needs, but was still emotionally connected to the original partner as well. I think my answer to that also kind of bleeds into our next slide. Should we move along?
Yeah, let's go on.
Okay. So one thing I really like to talk about, again, is get specific about your needs. And when we broaden what we understand as intimacy, again, our life gets really broad. So I'm going to just read off a few examples because there's a study out of the University of Florida that defines intimacy into 3 different categories. And that's intellectual intimacy, physical intimacy, which most of us think of when we talk about sex, and also emotional intimacy. Um, so, you know, intellectual intimacy is really broad. It can include spending time with someone you care about, communicating, getting to know another person, which is a lot of dating. Feelings of understanding and enjoying each other's company are all parts of intellectual intimacy. And this can include family members, intimate partners, friendships. You know, I definitely have some very non-romantic relationships in my life that are very intellectually intimate, like the people who really know my inner life. Emotional intimacy, I think, is one thing that when I do a lot of readings about challenges with couples or older adults challenges, is there's often a rift in this area where, Elizabeth, I feel like you were mentioning this too on another side of, often female partners are looking for a broader emotional intimacy or that caring and that touch and the affection. And men have gotten with, you know, when they're struggling with their aging body or where they're not pleasing their female partners anymore, and then they pull away. And there's a big disconnect that can occur there where communication can really heal that. Because it might be that you and your partner actually are looking for the same things, but you're trying to recreate what you did when you were 30. And neither of you actually want that anymore at all. Because it's exhausting and you're just, I just want to hold hands, man. Like, could we just watch a movie? So emotional intimacy, again, is feelings of closeness and sharing of experiences. Emotional intimacy can occur in both friendships, sexual partners, romantic relationships. It's very these are all very intertwined. So usually one leads to the other. Then of course, there's also physical intimacy, which is mutual activities that feel good to everybody that's involved. That might involve emotions or not. It doesn't have to be emotional to have sex. Sometimes we can have sex just for pleasure. Stress relief, it's a great stress reliever. It relieves a lot of body pain. You know, sex releases a lot of chemicals into our bodies that just feel really good. Like there's a reason we want to do it. And it also helps create a bond, which kind of breaks down some of the loneliness that we feel as we get older in life. Physical intimacy can literally range from a hug to full-on penetrative sexual intercourse. And so, Peter, I think in answer to your question, this might be something I would recommend to couples that are dealing with that challenge of cognition change or changes in desires and interests, is to start exploring their intimate lives outside of just like physical intimacy, into like, what other things did you share as a couple? Did you like to go for walks and hold hands? Do you cuddle? Do you talk after your day together over dinner? Like all of these things that help, again, develop that strong bond that leads to more satisfying, intimate lives. So one of the other things, of course, is our bodies change. You know, I myself am 42 and I'm shocked at how much my body has changed since I was 20. And I can imagine by 70, that will be even more so. And so I think part of the stigma around aging is that we don't want to really sit and think about the reality of that. So we try to ignore it, and then we push our bodies into situations that don't feel good. And then we feel like we can't do this anymore. And so there's a lot that can be done to accommodate and enjoy your changing body, because it's not always a bad change. One example I like to talk about is called the Met levels. And Met levels are something that's used in cardiac care a lot, or when you need to control your heart rate, especially after, you know, heart surgery, or if you have a heart condition. And so when you read the layout of a Met level, so a Met levels go from stage 1 to stage, I believe, 11. Don't quote me on that. I should know that. No, I'm sorry, stage 6. And they describe every kind of activity you can do, and your doctor, as you recover from these conditions, will tell you about, okay, at Met level this, you can do this and this and this. And in the formal list, it says you can have sex at level 5, which is very high in the scale. And I can remember working in cardiac rehab, and like patients would literally think that they couldn't do anything until level 5, which was months down the road. But when you really talk about the broad spectrum of, I think this is a great example of when you communicate with a physician and be like, what do you mean by that? Like, at what level can I hold hands? Can I kiss? How do I understand my heart? If I'm so excited from a kiss, it might be a level 6 or it might be a level 1, right? So like getting into the nitty gritty of what's important to you or what's important to your partners can really, again, expand your access, because people will take this as a literal death sentence to their sex life. And it doesn't have to be that way at all. You know, simply laying with a partner and holding them while they masturbate is probably a level 2 activity. You could do that pretty quickly after a cardiac event. Another big one is fatigue. I think everyone naturally experiences levels of fatigue as they get older, or they have particular conditions such as chronic obstructive pulmonary disease or diabetes or anything that impacts just your energy levels. I think one thing that we have to let go of sometimes is this idea that sex is supposed to be spontaneous and passionate, and suddenly it's just happening. Oh my God. And in like opening up the world to planning a little bit, I think sometimes people have a little grief around that. They're like, oh, that's not very fun. But if you can plan around your energy levels, you can really shift what you're able to do. If you know you're more energetic in the early part of the day versus later in the day, or if you know that like you have a date tonight, and so you're going to address, you're going to alter what you do in your day that's going to eat up your energy. So you're going to not cook a huge meal and clean your whole house and scrub the bathtub, so just being aware of your own abilities. Or your own energy levels. You're like, yeah, if I do all of this by 9 p.m., nothing will going to happen. And another really big topic that I just want to broadly discuss, because this is, again, something you can talk about with providers, is medication side effects. As we talked about, that dryness, that lack of lubrication is common to particular medications. Changes in erections or erectile dysfunction is a huge part of like blood pressure medications or other any medication that alters the blood flow excess, which is common when you have cardiac concerns, or changes in libido. I mean, we're all pretty familiar with, when we take SSRIs or like mental health antidepressants, it can really shift our libido. And there's things we can do about that for sure. And, one of the things you can talk about with your doctor is if it's really bothering you, you can ask to maybe try a different medication. That's a valid reason. As Dr. Martin was saying, it's an activity of daily living. It's important. And if it's really impacting your intimate life, it's okay to be like, hey, this is a real bummer. I'd really like to maybe see if there's another medication that might work for me, because a lot of SSRIs can impact us in different ways. And so the other part, again, is the physical, this is like my little quotes, but there's a lot of things we can do to help break down those barriers to like satisfying sex for ourselves, including preparation, positioning, and patience. And I'll just go through these pretty quickly. Preparation, again, that idea that you have to plan a little bit can really improve things. One thing, this is sort of related to joint pain and body pain, is if, taking a warm bath before you're going to be having sex, it'll reduce inflammation and pain in arthritic joints. It can increase your blood flow to your skin and sensitive areas, so it'll increase your sensitivity. It reduces muscle spasms and spasticity. There are just, some nerve conditions and blood pressure issues where hot baths are not a good idea. So as always, talk to your doctor. Anti-inflammatories, such as just, Advil, ibuprofen, if it's safe for you to take and you're going to be having a date in an hour or two, pop a few pills and kind of open up those joints and loosen things up, so you're not, like, oh, my creaky hip sort of situation. It can just, again, help just knowing your body and knowing, oh, this is going to make me sore. It's worth it. I'm going to take an Advil. And timing, this is really big in arthritis, and everyone tends to have a different pattern with it, but most people notice that they're the most stiff in the morning And by, mid-afternoon, after a lot of movement and activity, their joints have opened up and warmed up and they're not having that stiffness. So again, planning around your body's natural rhythms is really helpful. Positioning is huge. I feel like that's a thing that older adults often, again, they want to do what they did in their 30s. And it's just not fun. It's painful. It hurts. There's concerns about endurance and am I doing this well enough? And the whole point of sex is to have fun and for it to feel good. So if it hurts, don't stay in that position. Get off your knees, lay side by side. There's lots of different creative and fun things you can look up about how to take the pressure off, your knees or your hips, or, using things such as pillows or bolster rolls. They actually sell soft wedges that are made specifically for sexual function that you can buy that is furniture to help your body stay comfortable and support. I see you smiling over there. And just being like, yeah, this is my sex pillow. And this both includes partner sex and solo sex. As you get older, sometimes holding your hips open long enough can be pretty painful. So exploring with yourself about what positions look like and what you can do to change those things. And the other one is just to be patient. Older bodies take a little longer to warm up. Our nervous and blood systems are slowing down. And so the arousal you used to feel in 10, 15 minutes might take closer to 30 minutes. And there's a lot of fun to be had in that warm up time of taking your time, being creative, being playful, touching each other. Again, expanding that world of intimacy can lead back to that original feeling of arousal that people are used to. So do you want to talk about this one together?
Yeah.
Okay.
I mean, the things that I would just say is that all of these resources are going to be provided in the handout. Mm-hmm. These are just kind of more the visual. But yes, some of these are local resources. Some of them are podcasts and books.
Mm-hmm. Yeah. I'll walk through them really quickly. Shebop is a local Portland sex store that is very women-centered and very feminist, so it tends to be less intimidating for people. And they also, in non-COVID times, they run workshops and special classes, and there's all different kinds of speakers and specialists, and it's a very non-intimidating place for people to go and explore and find, toys and lubricants or just books that expand like what you are interested in. One that I'm really particular to is Sage, which is part of Portland Friendly House. And they are specific to gay, lesbian, and transgender elders. And so they are a great resource for people who are older and looking to date and feeling a little alone in their communities. They have dating events, they have dance nights, they have outings and events. They're a pretty fun group. If you click on, it'll be in the resource list again, but there's like a picture of everyone on a big like dragon boat adventure. And a lot of the information that I shared today is actually from this book called Naked at Our Age. And what I love about this book is it really demonstrates how to comfortably talk about the topic. So what it is it's stories from real people, and then they like tell about their experience, and then they'll have a square next to it that's from experts, and they talk about, oh, did you know all these things? So it's a great way to both not feel alone in your concerns and issues, and also to get some really solid expert advice. And I like Our Better Half. I actually haven't listened to it before, but I like that they refer to sex over 50 as modern sex for classic bodies. Okay, I think that's all that I have. How are we doing on time? Oh, we're doing great.
Yeah, we have a few minutes. Any questions?
So I know sometimes when seniors who are not heterosexual are looking to move into senior living, assisted living, that sort of thing, there can be some apprehension about, gosh, are they going to fit in, that sort of thing. I'm wondering, is Sage a good resource for someone to talk to about those issues?
Yes. The name escapes me right now, but they have a very specific list of LGBTQ friendly communities. And if you're in a community that's not being kind to you, what your resources and rights are. I think they can also connect you to ombudsmen. So yeah, they've done a lot of really specific research on they go into the actual communities and talk and like give everything a star rating. So there's a whole list of, and that might be a great resource for people who are looking for a community to move to, and they want to make sure that they're supported and don't have to go back in the closet, which would be a really heartbreaking thing to have to do as you get older. That's a great question.
And sort of a follow-up thing too, and this is sort of something that people laugh about, I've heard, but there's this idea that senior living communities are kind of a hotbed of STDs and STIs, and I wonder if there's any truth to that, and kind of maybe as a follow-up too, is the prevalence of STDs and STIs in seniors, is that sort of on par with other age demographics?
That's a great question. I would say that I don't have any like specific statistics on that, but I mean, I do think that community, living in communities could potentially, I mean, I think that there could be some truth to folks having, different sexual lives, once in facilities or once in residential living, retirement living.
Yeah.
Yeah.
I'd agree. I don't have the numbers in front of me, but I definitely see that repeatedly when I do these readings about it's actually a pretty high percentage in the community. And I think a lot of it is what Dr. Martin was talking about this mindset that you no longer need protection when you can't get pregnant anymore, which I think is partially a generational issue, and also just, yeah, seniors are having a lot of really exciting sex, but they're not necessarily being connected to the resources that they need.
All right. Anybody else have any other questions?
I think there's one more slide too.
Oh, let me click that. Oh, yes.
Excellent. Thank you. Awesome. Great. And I hope that you include your contact information in the resource list as well.
Yeah.
Thank you too. So fascinating, so interesting. You're a wealth of information. We will be sending out this recording in the email and with a handout, as well as a survey on how we're doing, topics you'd like to see in the future. Next month's topic, it'll be on June 3rd. Correct me if I'm wrong, June 3rd. And the topic will be preparing your home for sale or aging in place.
Oh, yeah.
So thank you too. Wonderful information. What a pleasure. Thank you.
Yeah, thank you so
Thank
much
you
for
so much
having
for
us.
having us.
Yeah. Okay, let me stop that. Sorry, it's been fussy.